Hello, I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane, and I'm with Lucy Angelini, a shoulder physiotherapist who works with me. Have you ever thought of what would happen if you break your shoulder, if you fracture it? Have you wondered what's going to happen to you after the operation? What does it look like? Well, we're going to talk about that now. We're talking about shoulder rehab after an open reduction and internal fixation of a proximal humeral fracture. So a plate and screws once you've fractured your shoulder. So Lucy, this is usually a pretty traumatic event. Someone's had a big fall, usually pretty sore, pretty nasty, everything's pretty swollen, and they're coming in to have that fixed. Typically, you're looking at an open operation down the front of your shoulder and a plate and screws to fix it all together. And usually a graft as well. Usually the shoulder's been compressed down, and once we pull it out to the right length and get everything in the right position, it needs some graft and bone graft in there to fill the gap and help with the fixation. So it's an open operation and you're going to be in hospital at least one night, usually just one night, but sometimes longer depending on how things are. And that next morning, the nurse is going to be looking at the dressings, you're going to go down for an x-ray, and the physio is going to come and see you. What's going to happen when the physio comes to see them?
Yeah, so like you say, it's sort of they've probably had a fall or an accident, and so things are a bit sore anyway, and then having surgery on top of that. So oftentimes the arm and even the hand can be quite swollen.
Yeah.
So we might put some tubie grip on for you to help with that, and we're going to show you some really gentle passive range of motion exercises so that you can shower and get dressed and all those things that are really important. We're going to teach you how to take on and off the sling and make sure that it fits really well, because that's very important, because you'll be spending a few weeks in it. And just reassure you and educate you that, you know, you're going to get there.
Yeah. And typically you'll have a sling that has a shoulder bolster on it, a pillow or bolster, and that can be taken off. And from my point of view, it's whichever is most comfortable, whether it's more comfortable on or off, and you can work that out with your shoulder physio. The sling ideally needs to come up to the knuckles, because otherwise, if it's coming up to the level of the wrist, you tend to run into problems with wrist pain or wrist issues. You can get quervainous tenosynovitis. So we want it up to the knuckles, not the wrist, and we want you to know how to put it on and take it off and put it back on, and also how to shower and how to put a shirt on or a t-shirt on. So make sure you go through all those things with your physiotherapist. There are videos on the website which you can go to, which Lucy features in, and so they're there as well. But go through it with your physio before you leave hospital. You typically will leave hospital 10 a.m. the next day, and then you're in a sling for 6 weeks. Now, exactly what you do with your rehab will depend to some extent, to a large extent, on just how solid the fixation is. If you're a bit older and your bones are a bit soft and a bit weak, we may be locking you down a fair bit. If you're young and very active and the fracture was fairly simple and straightforward, we may be pushing you faster with your rehab. So that will be explained in the post-op notes, and you'll have that. You'll have this protocol for the physio, and you'll be able to go to your physio. When do they go to their physio post-op?
So normally in the first 2-week mark, you'll be given the very sort of gentle, simple exercises in hospital, and then you can go to your physio at the 2-week post-op mark, and they can check your wound and make sure that all looks okay and run through your exercises with you. They might do a little bit of soft tissue work just to help with pain management, and also teach you how to do some massage for the swelling.
Your physio will have details about your operation from me. My office will have sent them the rehab protocol that I follow, that Lucy will have developed, and they will have also the actual operation itself. So they'll have a lot of information. You'll have that as well, so take that with you, and you'll also have the little video that I do explaining the operation to you, and that's very helpful for the physios to see if they're not sure of where we're up to with this. And in this situation, I think the more information you take the physio, the better.
Absolutely.
So the first post-op visit with me is at 6 weeks.
Yep.
What happens then?
And so they have an x-ray?
Yes, you'll have an x-ray. You want to check that everything's sitting in the right position and that things
Exactly.
haven't shifted. It takes about 6 weeks for things to heal up. So we want to know at that point that it has healed, that it has the bones joined up and united, and that you're well set up for a good result down the track. So we want to check that.
And then at 6 weeks, if it's all healing well, you'll come out of the sling, which is exciting, and we'll get you moving. So oftentimes you'll be quite stiff when you come out of the sling because you haven't moved your arm normally for the 6 weeks while it's been healing. And so we give you a range of stretches, a big stretching program to get your movement back.
Yep.
We want to encourage light use, so we want you to start to use your arm for all your light, normal day-to-day activities. And we don't want you to do any heavy lifting, but we want to encourage use.
Yeah, it's really important for you to know that typically it takes a long time to get your range of motion back after one of these operations. And that's not so much the operation, it's actually just the nature of breaking your shoulder, fracturing your proximal humerus. Even if we're not operating on the shoulder to put it back in the right position. And the reason for the surgery is to get all the bones back to where they need to sit so that when it heals up in the right position. It will heal up one way or another. And whether you have surgery or not, it typically takes at least 6 months to get your range of motion back. Surgery may slow it down even further, but the underlying problem is just the nature of the condition, of the trauma associated with it. So don't be surprised that it takes 6 months to get range of motion back, and it's not unusual for it to take 12 months to get the range of motion back, is it? It's just a slow process.
Yeah, these are often, very slow. And we're just looking for, regular gains, moving in the right direction, being on top of your pain, being able to sleep, all those kinds of things. Yeah.
So the next visit with me is at 12 weeks. What do we do at 12 weeks, Lucy?
So 12 weeks, we're usually still working on your range, but for the range that's come back, we can start doing a little bit of strengthening as well. So to make all your day-to-day things a bit easier with a bit of strength, and we can start talking about timeframes in terms of returning to whatever activity is important to you. Yeah.
And Lucy and I will write to your physio at each visit to keep everyone in the same loop as to what we need to do with your shoulder rehab so that your physio is well informed. It's really important your physio knows what the plan is and knows what the changes to the plan are. And, Lucy only sees shoulder patients all the time, so she's very good at working out just where you need to be. And then typically we'll see them back at 6 months and again at 12 months.
Yeah, yep. Just make sure that you're getting to where, you need to be, supporting you and just reassuring you that it's all going in the right direction because they can be slow. Yeah.
So I think it's important to really get that idea that the rehab is slow in terms of getting a range of motion back. Do not be disappointed if at 3 months you don't have a lot of range of motion. That's actually normal. The range of motion typically does come back. It's very rare not to see someone get their range of motion back, and that will be at 12 months. At 12 months, if you're really tight, and that's in a very small percentage of patients, maybe 5%, I will talk about an arthroscopic release, so keyhole surgery to go in there and free the shoulder up and take the plate out. The plate can be taken out arthroscopically. It just needs a small incision big enough just to slide the plate out. That's not something we do unless we really need to, but if you've got shoulders very tight, it can be done. So I don't want you to worry that you're not going to get the range of motion back. We will get your range of motion back one way or another for your shoulder. The other thing that can happen is avascular necrosis. Now, the blood supply to the top of the humerus, the humeral head, it's covered in cartilage, so the blood supply comes in from underneath. So the fractures typically disrupt that blood supply, and the blood supply has to be re-established. The blood vessels have to grow back into that piece of bone to give you the blood supply to it. If that doesn't happen, then the bone will die, and then the cartilage will collapse. That's called avascular necrosis, or AVN. And that happens in a small number of patients. It's related to the trauma of the fracture. It can be contributed to by the surgery as well, but you can get AVN whether you have surgery or not. AVN is something that if it's just a little area of AVN won't be a problem, but if it's a big area, which can happen, then we're probably looking down the track at shoulder replacement surgery if it becomes really painful, and it can. The other thing that can happen is the fractures tend to settle. They have this tendency to sort of, the head of the humerus, the ball, tends to settle down onto the shaft, and occasionally the screws can then actually perforate through the articular surface, and you may find that we need to take out some of the screws at some stage. That's rare, but certainly does happen occasionally. So I think it's good to know that the rehab after a fixation of a proximal humeral fracture is not super quick, and it's not necessarily plain sailing. There are some things we've got to watch out for. So it's a big deal.
It is, yep. And oftentimes it's older people who've had falls, so they can have, other issues as well.
Yeah, younger patients tend to dislocate the shoulder, but when you're older, you tend to tear your rotator cuff or fracture fracture the shoulder, don't you?
Yes, yeah. So your physio can help you with maybe some balance issues or, some strategies to
Yeah, I
prevent any
think physio is
falls.
very helpful for this operation, isn't it? Physio's really
Get involved.
get involved.
Yeah.
So that's an overview. If you have broken your shoulder and you're staring down that pathway of shoulder surgery, that's an overview of what to expect after the operation, and it's a heads up as it is a big deal. Thank you for listening.